Hello, my name is Rocio Alvarado, and I will be talking about in this presentation all about the acting out cycle. So we have phase 1, which is calm. A child is goal-directed, cooperative, compliant, and academically engaged. Basically, the child is listening, focused on what they're doing, and they are engaged in what the classroom activities are at the moment. And at that moment, the teacher response is keeping a classroom structure and management plan, teaching social and behavioral expectations that keep the child calm, and giving students levels of attention. In phase 2, we have triggers. And these triggers are usually unaddressed concerns that are negative interactions with teachers or students or other friends, arguments with peers, routine change, high rate of failure on academic tasks, confusion on assignments, hunger, lack of sleep, medical problems, stressful home situations with a kid, with a student at any age. You just never know what is going on in their heads and what triggers they could have that could set them off in the classroom and that will have them behaving in a manner later on. Now, pre-correction plans for the student is, number 1, as a teacher, you should know each and every one of your students. When you have new students, that's when you start to learn how your students are as the days and months go by. At a certain point, you know who your students are, maybe a little bit of background information by that point. And so some plans for each of these kids could be breakfast and lunch arrangements. For example, if they hadn't eaten, or you know that that student does not eat before coming inside the classroom, then you can have a breakfast set aside for them or a lunch set aside for them if they can't afford lunch, because having them be hungry could actually trigger them misbehaving in the classroom later on. And we can have meetings with the child themselves, and if necessary, we can have meetings with parents about tardiness, if the child is tardy every morning, or if you see that the child is going through any issues. Pre-alerts for students in case of schedule changes. There are many children who can't handle a schedule change. They feel safe when it comes to routine and consistency, and if anything changes, that can set off a child. So letting the student know that this is what's going to happen beforehand is a good way to have these triggers not go off later. And clarifying expectations of what you want from the student in certain activities that you are doing throughout the classroom and throughout the day. In phase 3, we have agitation. So the child behavior is unfocused, darting their eyes, tapping their hands, moving in and out of groups, starting and stopping activities. The teacher acting out because of this interruption, you would simply state what the child is feeling. So if you see that the child is starting to misbehave just a little bit or starts to get a little antsy, you can go up to the child and ask them, what's going on? What is it that you are feeling? Use your words and tell me what it is that you feel at this moment. Why are you getting up? Why are you messing around with friends? You can state their struggles before the agitation sets. Sometimes the child doesn't know that they're struggling at the moment, or they don't know that they need help. So that's where the teacher comes in and tells them, hey, I can help you with this. I can help you solve this problem. And the child will see that they do need help. Or you can shift your instructions to accommodate with the child. So if you see that you're teaching the children, but this child isn't really engaged with you, you as the teacher should already know that you should already know or have a backup plan for each student, especially in a classroom full of students that are each individually unique. So sometimes teaching techniques won't work. Some certain teaching techniques won't work with some students. So you have to have a backup plan or have a way to engage the student that's starting to be agitated at this very moment so it doesn't progress. Acceleration is phase 4. The student behavior is focused and engaged to teacher. So they start questioning the teacher, arguing, refusing to do work, rushes assignments, but gives poor quality work. And basically saying, you know what, I'm going to do what the teacher wants me to do, but I'm not going to give any effort. It's super fast, poor quality work. That's what happens in the acceleration phase. The teacher response when this happens is redirection. Redirecting your students, listening to the students, and patiently gives time to respond, especially in various ages. The younger they are, the more slower they might be able to respond. So yes, we need to be patient. You reinforce students. Do not engage to child's misbehavior. So don't add on to their misbehavior. You always have to act in a patient and calm way, especially if the child is starting to backtalk to you. Don't feed into their behavior, basically, because that'll just make them want to backtalk you more, as the teacher, or make them want to misbehave even more. You can make small requests to them, make a list of small doable goals for students to be able to achieve. So don't make it a huge thing. Make small little goals that you know that the student will be able to do, and maybe just slowly they will be able to do the work that you need them to do. In phase 5, we have the peak, and the student behavior is out of control, physically assaults others, hurts themselves, destroys property, cries hysterically. They are very loud and explosive. I've seen this before, and I've worked with various ages, and the one age that comes to mind is toddlers. At 2 years old, they can get upset fairly easily at that age. So I've seen all of these behaviors unravel, and as they peak to it, the teacher responds knowing the school plan for out of control students, for insurance on other students' safety. So what is the school's goal? So if that child is already at their peak point and they're going just out of control, throwing things, hitting friends, you should always know what you need to do in your school. For example, I would have to take the child aside and away from friends in order to ensure that my other students are safe away from the out of control child, and then maybe call management, not to take them out of the classroom, but to come and help in a situation where maybe another person can come and talk to them to see if the child will come down as they are at their peak phase. In phase 6, we have de-escalation. So the child behavior right now is confused, disoriented, far less agitated, withdrawal, denying any responsibility or involvement, blames others, and may try to reconcile. The teacher response, we figure out how to have the child leave the situation with dignity, give them an independent activity that is at their instructional level, and reapproach the child later as they are already calming down. Phase 7 is recovery, child behavior. They might avoid talking about the situation. They are generally subdued and debriefing. Teacher response, as the child is recovering, they're calming down. You ask the child what happened so they have the chance to express themselves on what just happened. Make a plan of action and result of why the child misbehaved in the first place. So find out what the problem was and how we can avoid it in the future. Talk to students about ideas for plan of action. So the student might be more comfortable knowing that, hey, if this happens in the future, now I know how to control myself. And the student will remember that they talked to the teacher about this plan of action and will be more prone to doing it in the future. Now, we have examples across multiple classroom and school contexts. This actually happened this morning. So a toddler A, was eating breakfast when another toddler B comes to their breakfast and steals some of their cereal. Now, this toddler is already known for getting upset easily. They don't restrain whatsoever. So toddler A gets upset, so upset to the point where they don't have a agitation phase, none of those phases. They skip right to the peaking point where they go out of control. They get upset to the point where they skip each phase and jump into out of control by chasing toddler B to the ground and punching them continuously without stopping, while at the same time screaming and yelling. So toddler A is out for revenge, guys. They really, really got super upset that their cereal was taken this morning, and they went after toddler B. So as a response, as this toddler's teacher, I separated both toddlers and gave toddler A a chance to calm down first, because they were throwing a fit, and it did take a bit for toddler A to calm down. And once they were calm, I asked them to say in their own words what had happened. And toddler A is able to communicate back with me what had happened at the moment. And toddler A responds while the teacher, patiently listens. So toddler A, I placed them further away from toddler B because I know toddler B is prone to doing it again. Toddler B does like to take food from other friends. So I safely placed toddler A away from toddler B, while also speaking to toddler B about not stealing our friend's food, that it was not kind, and that we need to keep our hands to ourselves, and to also apologize to toddler A for having stolen their cereal. So sometimes it's really good to talk to both toddlers and both sides of what has happened, and for the most part, it works pretty well, being able to hear out, especially what the toddlers need to say. At any age, any student needs to be heard about what had happened. That way they can calm down, and hopefully in the future they know how to better behave themselves in that situation. It's never too young. It's never an earlier age to start with them. The younger you can have them express themselves, the better they are able to reassess themselves in a situation like that. So the de-escalation plan that I made here is, if the child continuously keeps hurting other friends and results of something upsetting him or her, I would like to put there, you back away other students first for their safety and place the child in a safe, quiet place that will let them express their emotions. If needed, I would call a manager or principal to come and help me with the child in the classroom first before stepping him or her outside of the classroom. I let the child express their feelings to the point where they calm down, and if the child continues to behave this way on a daily basis or throughout the day continuously or without stopping, it's time to set up a meeting with parents to talk about strategies that could help the child and student in their classroom. Well, maybe possibly, if needed, a manager or a principal there as well that will be there to talk with parents and the teacher on how to have this action plan in place. And I've seen this in my own workplace, that we've needed to talk to parents about behaviors that a child has had, and they're very necessary. So this would be the intensive intervention that I would have in place. And additional resources here I put are, helping with student behaviors in the modern classroom. This is a great resource here. There are some good tips in there, and classroom management. You should have a classroom management in place when you are to be a teacher. I think it's so important to have classroom management. Your class will go and flow so much better throughout the day if you have a good and set plan. And here's some good tips about that as well. And thank you guys for listening to my presentation.